Hey guys, Ralph Havens here, Beyond Limits Physical Therapy in Bellingham, Washington, in Fairhaven. And today's video is about getting over chronic running injuries, chronic or recurring running injuries. I'm talking hip pain, knee pain, back pain, calf strains, plantar fasciitis, Achilles tendonitis. You know, when you're dealing with a chronic running injury, of course, we're going to go to physical therapists, chiropractors, massage therapists, all sorts of people. And what are we going to be working on? The tendons, the ligaments, the connective tissue, the joints, the muscles, doing dry needling, massage, adjusting it. But what if it doesn't work? What if you have to keep going back? What is that all about? And what I'm going to tell you is the thing I've found over 40 years of physical therapy training, integrative manual therapy, the key is to find the root cause. Now, when we think of, say, for example, a lower leg injury or a hip injury, we think it's going to be muscles and joints and that sort of thing, and you're going to, of course, go to a physical therapist, chiropractor, massage therapist to fix it up. What I've found is if it's not going away, it's not a muscle, a joint, a connective tissue. It's not that type of problem. Yes, those things are problematic. They're tight, they're restricted, the joints are out, but that's not the cause. And what's the cause is something that's a little more important to the body. We call it hierarchy of protection, which basically means the body, your body, is doing the best it can do. And when we see a problem that's not going away, what we're dealing with is that your body's protecting you from something. Now, I'm going to tell you a few stories to give you an idea of how this works and a way out, a way to actually find the root cause for you. So when I was 37 years old, I'm 66 now, I was 37 years old running 70, 80, 90 miles a week. All of a sudden I couldn't run. I was already a physical therapist, had a clinic in San Diego, 5 therapists working for me, and I couldn't run. I had a calf spasm that was 5 minutes of running, and I'd have spasm, have to walk home. And I was getting all sorts of treatment, 3 different pairs of orthotics. Nothing was working. I finally went to a therapist, Julie Cicino, in Los Angeles, and she was doing integrative manual therapy. And she put her hands on me. We call it myofascial mapping. It's a way to find the root cause. And she said I had a problem with my heart, with the big aorta in my heart, the big blood vessel. And my body, in its wisdom, doing the best it could do, was protecting me by spasming my calf. Smart body. So all that treatment to the calf, that wasn't the problem. She worked 2 hours up here doing very gentle techniques, things that I know now after taking 116 classes in this method over all those years since 2000. She worked on up here, and this restriction cleared. And she gave me some things to do, and 2 days later I went for a run and I was back to running. And it never looked back, it never came back, and I started to learn this way of working. I've had runners recently, middle school, high school, and college runners, and even post-collegiate runners, and I found some interesting things. There was hip pains, one guy had a knee pain, somebody else had 2 people with hip pain, and a couple of with knee pain. There was a little handful of runners that I just recently treated, and what we found, one of them had a problem with the colon, very common problem with the what's called the ileocecal valve and the cecum, the right side of the colon that was affecting the pelvis. Yes, the pelvis was locked down. Yes, the hip was problematic. The biomechanics were off. But when we restored the healing to the colon, the body didn't have to protect that anymore. I gave them some things to do at home to support that part of the body, the colon, and they got back to running. One of them PR'd in the mile later that season. He told me he could never have done it without me. Another person was unable to run for more than a minute due to severe pain, and we're talking a young runner, hadn't been able to run her track season, and she was back to running after a week of doing one session and then finding the root cause. And she did see me once a week for a while, and we got her to a whole new level, and she ran really well that season. The other guy was a vein here in this part of the body. It's called the common iliac vein, and it had a little disruption in it, a little tightness, a little problem, and the body's protecting a vein, causing a hip pain and a groin pain. So all the treatment and all the rest to the groin and the hip and that area wasn't doing anything. It was protecting something right here that was more important than the pelvis. The pelvis was just locking up to protect this vein. So the key that I wanted you all to get is that there's a reason. If you're not able to run, there's a reason. And the key is to find out what it actually is and then to have techniques to actually fix it up, to heal it up. So that's what I do. It's called myofascial mapping. It's a way to put your hands on the body and find the primary root cause. I know it seems crazy to think this. I had a coach today say, well, how do you do it, Ralph? I've got training, basically. Not basically, I've got training. And I've been taught how to put my hands on or even see it. I can literally see it when somebody's standing in front of me and walking and moving. I can see where the root cause is. And I can then put my hands on if they're in person. But even if they're over Zoom, I can see where the root cause is and give somebody the precise things to get their running back, to get their health back. So the reason I'm saying this is so that if you are dealing with a chronic running injury, if what you're using isn't working, if you're looking for what's the root cause and get your running back, then reach out to me, 360-599-2217. I'll put links below, ralphhavens.com. And whether you're online worldwide, I can look at you over Zoom. Ideally, you're here in Bellingham, Washington, in Fairhaven. I'll put my hands on you in my clinic. We'll see what the problem is, and we'll get you on the road to running again. So again, my name is Ralph Havens, here in Fairhaven and worldwide. Reach out to me if you're dealing with any kind of problem that's just not getting fixed up, and we'll get you started. All right, you guys, let's get out there, let's run, and have a good time on the trails.